Today we'll be discussing about the dangerous area of face. What is dangerous area of face? It is the area of the upper lip and the nose. This area, it is a triangle, nasolabial triangle, like the Bermuda Triangle. Whatever happens here is problematic. So it includes the upper lip, the corners of the mouth, and the upper part of the nose, and the area of the cheek between the angle of mouth and the upper part of nose. That is nasolabial triangle. Why is it dangerous? Because any infections of this area can spread to the cavernous sinus and in turn spread into the brain, causing meningitis or brain abscess. So any infections of this area, any furuncle, any bacterial infection, any abscess formation, if you try to squeeze any pimples, any piercings over the nose or the lips getting infected, any trauma causing any septal abscess, or the infection can spread via the facial veins into the cavernous sinus, causing cavernous sinus thrombosis, and from there it can spread into the brain, causing meningitis and brain abscess. That is why this area is known as the dangerous area of face. Let's see what is the venous drainage of the face. The supratrochlear and supraorbital vein joins together at the medial canthus of the eye to form the angular vein. The angular vein continues as the facial vein. So the angular vein descends down the lateral aspect of the nose and it receives the inferior palpebral vein, external nasal vein, and it comes down to receive the superior labial vein, inferior labial vein, and deep facial vein. So the deep facial vein originates in the infratemporal fossa from the pterygoid plexus. And this pterygoid plexus is connected to the cavernous sinus via the emissary vein. So it receives a deep facial vein, and then further it comes down and it joins the anterior division of the retromandibular vein to form the common facial vein, and it drains into the internal jugular vein. Also, how is retromandibular vein formed? The superficial temporal vein and the maxillary vein joins to form the retromandibular vein. At the inferior pole of the parotid, the retromandibular vein divides into anterior and posterior division. The anterior division joins the facial vein to form the common facial vein. The posterior division joins the posterior auricular vein to form the external jugular vein. The facial veins do not have any valves. So it allows bidirectional flow of the blood. So the infection from here drains into the facial vein and it can go to the cavernous sinus via the deep facial vein, pterygoid plexus, cavernous sinus. Also, the facial vein have connection to cavernous sinus via the ophthalmic veins. So two connections are there to the cavernous sinus. Also, the facial veins are in the muscles. There is no deep fascia in the face, so it is directly onto the muscle. And any contraction of the muscles can cause the retrograde flow in the veins and the retrograde transport of the clots. When this area is infected, there is sepsis. So a septic emboli can be formed and it can spread to the cavernous sinus, causing cavernous sinus thrombosis. So what are the symptoms of cavernous sinus thrombosis? Patient will have high-grade fever, headache, and ophthalmoplegia or proptosis. The cavernous sinus is known as a jewel box and it is related to lot of nerves. It contains the oculomotor, 3, 4 ophthalmic and maxillary nerves from the trigeminal nerve in the lateral wall of the cavernous sinus, and the abducens nerve and the internal carotid artery goes through the surface of cavernous sinus. So cavernous sinus is involved. All these nerves can be affected. Further details of the cavernous sinus thrombosis, treatment and complication I'll be explaining in another class. So dangerous area of face. It is a triangle, nasolabial triangle. Any infection here can spread to the cavernous sinus and into the brain. It is because of the large anastomosis of the veins of the face, and also the facial veins are valveless.